All right. I'm the interim medical director at Penn Foundation. I have my responsibilities as a psychiatrist as well. So most of my time is taken up by my inpatient, assessments. There's a couple of days a week where I do some outpatient assessments and, all the follow-ups and, seeing patients, whatever needs that they might require. Then some amount of STEM also with issues that happen administratively, with other psychiatrists who work at Penn Foundation. That's both in the recovery center as well as in mental health. So
Great.
yeah, that's my typical week. When you train to be in addictions, you are, of course, trained in all the medications that can be used in the different kinds of, addictions that we come across. Most of the people, because we have an opiate crisis going on in this country, most of the people know about Suboxone, methadone, medications like that are used to treat opiate disorders. Then there are for alcohol, it has its slew of medications that can help with alcohol use disorders. Similarly, for nicotine, tobacco. Unfortunately, not all of them have medications that can, which are specifically targeted to that addictions. But, we can, of course, use supportive medications, like if somebody's coming off of cocaine, withdrawing from cocaine or crystal meth, one of the side effects would be, hypersomnia. They sleep a lot, they eat a lot. So those kind of things, we just like kind of address them symptomatically.
Mhm.
So yeah, if you're asking about what my experience with medication is, we do what we can. We try to help them out, whatever we can in terms of symptomatically, as well as those medications which are specifically designed to, address those specific addictions. Okay, so I've always had an interest in addictions since med school. I had a close friend of mine who passed away from withdrawal seizures related to benzodiazepine abuse. So, that's probably my first exposure in recovery and addictions. Since then, it's always intrigued me. I chose psychiatry as my residency. Psychiatrists were the ones who seemed to work most with this population. I have learned that we have to be very patient. Sometimes the mistakes that I have made and I've seen my colleagues make is running out of patience. This is a very difficult illness to treat, and we know we have the medications, we know we have the therapies, the sessions, and all that we do, but a lot of people struggle with it, and it's very, very difficult to treat. To be able to um, get them into that stage of change where they can actually, because you're working with a person, I mean, whose brain's been consistently bombarded with these chemical over years. And now, many times I feel some people just want to flip the switch and make that, wait, just choose to do, this over that. It's not that easy. And I want the community to understand that about addiction disorder, to be able to, kind of understand it as a actual, neurochemical change that's there. And that's what we're trying to treat. That's how that using medications or using psychotherapy. So I think that message, if the community understands that, they can see the seriousness, and then they can see how possible it is that, to get somebody into recovery and, make their lives better. It's this part of our work. This is what we're here to do, right?